we continue Chapter 1, An Introduction to the Human Body, Part 2. What is anatomical position? Every time when we start learning the human body, the location of different organs and structures, we always assume that body is located in the anatomical position. It means the body is erect, feet slightly apart, palms facing forward, and you, the observer, is standing in front of the body. So sometimes when a body is lying down, it's described as a prone or supine position. We will use those two terms, prone and supine, only related to the cadaver when we study the cadaver during the labs. So when the body is face down, it will be a prone orientation. When the body is face up, laying on the table, that will be supine orientation. In all other cases, we assume that the body is in a standard anatomical position. Regional terms. What are regional terms? If you are a health care worker and you have a patient with a wound and you need to write down your nursing report and indicate the location of the wound, it would be really not comfortable to write down, somewhere on the back, right here, to the left from midline. We have special regional terms for that, to describe a location of different wounds or maybe tumors or something else on the body surface. Here are the names of those regions, and some of them you need to memorize. Let me name those regions for you. So face, that would be facial region. They are underlined with the red line. Next one, armpit would be called an axillary region. Next one, around the eye would be orbital or ocular region. Neck, that would be the cervical region. Right here, the chest would be thoracic region. Here would be abdominal region. Under it, there will be a pelvic region. And finally, right here is inguinal region. On the back surface of the body, you need to know dorsal region, right here, large region. Then lumbar region, right here. And that's it. If you memorize more regions, it will help you later when you read your nursing book, if you are in a nursing radiology or some other healthcare programs. Directional terms. Those terms we are using only when we compare a location of two structures. You cannot say, for example, that ear is anterior. You need to have two structures. You can say that ear is posterior to the nose, or nose is anterior to the ear. So that's the first thing. We are comparing two structures. Now, anterior or ventral and posterior or dorsal. It is related to the body surface. Anterior describes a structure that is located closer to the frontal surface of the body. Posterior describes the structure that is located closer to the posterior surface of the body. Example. Let's talk about our ear, eye, and nose. Nose will be anterior to the eye. Nose also will be anterior to the ear, because nose is the closest to the frontal surface of the body. Ear will be posterior to the nose. Ear also will be posterior to the eye. How about eye? It depends. If we are comparing the eye to the eye will be anterior to the ear, but the eye will be posterior to the nose. Next pair of the directional terms. Superior or cranial describes a structure that is located closer to the top of the body, sometimes called cranial. Inferior is describing a structure that is closer to the feet or to the lowest part of the body. For example, our head and our shoulder. Our head would be superior to the shoulder, and shoulder will be inferior to the head. But if we compare our shoulder with our knee, our shoulder will be superior to the knee, and the knee will be inferior to the shoulder. Always comparing two structures. Next pair of terms, lateral and medial. If we imagine a midline that goes through the center of the body, all the structures that are closer to the midline will be called medial. Everything what is away from the midline will be lateral. So let's compare our nose and our ears. Our nose is right on midline. So when we compare those two, the nose will be medial to the ear, and the ear will be lateral to the nose. But what if we are comparing our ears and our thumbs? Related to the midline, ears are closer to the midline. So ear will be medial to the thumb. Thumb is away from the midline, so the thumb will be lateral to the ear. The next pair of directional terms are proximal and distal. Pay attention, in a limb, we use those two terms, proximal and distal, only in 99% of cases when we are talking about our arms and our legs. Our arms have a point of attachment right here in the shoulder. Our legs have a point of attachment to the body too right here. So when some structure on the arm is closer to the point of attachment, it will be proximal. When it's away from the point of attachment, it will be distal. For example, elbow. When we compare elbow to the shoulder, shoulder will be proximal to the elbow because it's closer to the point of attachment, and elbow will be distal to the shoulder. But if you compare your elbow to the thumb or to the hand will be distal to the shoulder, and shoulder will be proximal to the hand. One more pair of the directional terms is really easy, superficial and deep. It's all related to the skin. If something is closer to the skin, it's superficial. If it's deeper inside of the body cavities, it will be deep. If we compare skin right here with the heart, skin will be superficial and the heart will be deep, comparing to the skin. But what if we are talking about ribs? Ribs are located under the skin, so ribs will be deep to the skin. But the heart is deep inside of the rib cage, so the heart will be deep to the ribs, and ribs will be superficial to the heart. Okay, now please pause the lecture and try to answer those questions. I would highly recommend you to write down your answers, and at the very end of the lecture you can read the correct answers at the last slide. Okay, take your time and answer those questions.